Well, the local government ministry has been coordinating all the metropolitan, municipal and district assemblies to enforce bans on large gatherings and other measures. It has a statement out, and I'm going to read for you what that statement says. It is, as you see on your screen, dated yesterday, the 16th of March. And it says that in response to the coronavirus outbreak, His Excellency Nana Akufo-Addo, President of the Republic, announced a number of measures to contain and prevent the spread of the virus. Well, that's the Ministry of Local Government and Rural Development was tasked by the President to liaise with relevant authorities to improve hygiene standards in the market. Pursuant to the above, the ministry directs all metropolitan, municipal and district assemblies to put the following measures to place, and it goes on to list those measures. One, to set up public health emergency systems to operationalize and monitor implementation of the directive within their areas of jurisdiction, especially at marketplaces, lorry parks and other public places, to prevent the spread of the virus. Number two, the Public Health Emergency Committee should be made up of the following, and it goes on to give you a list of who should be on that list: Metropolitan, Municipal, District Chief Executives as a chairperson, the members of the Metropolitan Assembly, Municipal and District Security Committees, District Director of Health, Director of Education, Director of Information, NADMO Coordinator, Environmental Health Officer, Community Water and Sanitation Agency, District Office of the National faith-based organizations, transport unions, market associations, District Environmental Protection Agency Officer, Assembly members, and it goes on and on and on. It also says that MMDCEs should negotiate for free airtime on FM stations in their respective districts to broadcast messages and educate the public on the preventive measures. And they're also tasked to enforce the bylaws on food safety, environmental sanitation, hygiene, and also on entertainment and outdoor events. They're also to ensure the availability of hand washing facilities with running water and hand sanitizers, advantage points in markets and all such public places. In the final paragraph, by the way, it says that all regional coordinating, well, the last but one paragraph says all regional coordinating councils are to coordinate and ensure compliance with the above directives and submit bi-weekly progress reports to the Minister for Local Government and Rural Development on what they've done so far as the implementation is concerned. Now it says that in the meantime, the ministry is working on leveraging resources to improve on sanitation conditions in our market. It's signed by Haji Halima Mahama, Member of Parliament, also the Minister for Local Government. Now, if you get to any of our markets, you see the crowdedness and just how difficult it might be to observe social distancing in circumstances like this. Well, already the assemblies have started complying, and we'll talk to you about the Accra Metropolitan Assembly's response to this. Here is a statement that the Accra Metropolitan Assembly released, and I'm going to read it to you. It says, in line with the President's directive on measures to contain, it goes on with the preamble, and let me just take you to the subject matter and what's at the heart of it. It says that the conduct of marriages are the A.M.A. Hygiene Bylaws 2017 of the Assembly. Also a very curious part that we'll be talking to the mayor about. Now it says all public toilets in the metropolis have been directed to provide hand washing facilities at their entrances under acceptable sanitation standards as prescribed in the Sanitation Bylaw 2017 of the Assembly. Now, number 5, it gets to talk about what drivers are supposed to do. Now, drivers should endeavor to disinfect their vehicles, that is, to target the seats, the door handle, etc., using the bleach solution, which is Parazone, and provide hand washing facility in Veronica bucket, liquid soaps and hand sanitizer. Now, yesterday when we went to the station, the various stations, you heard some of the drivers say they can't afford these things. They're hoping that government will help them raise them. We'll find out from whether they're in the position to do so. And number 6, it says to intensify public education on preventive measures in markets, communities, as well as other public places by the Metro Information Services Department, which commenced weeks ago. The Public Affairs Unit of A.M.A. will provide daily updates through their social media handles and other information outlets. The assembly, therefore, entreats everybody to frequently wash their hands with soap under running water for 20 seconds, use hand sanitizers, and cover your nose and mouth when sneezing or coughing. Again, they remind you that if you're experiencing any of these symptoms, these are the numbers to call. Do not walk to the hospital. If you experience any of these, just give them a call. And that is 0509-497700 or 0558-439-864. So this is how the A.M.A. reacted to the Ministry of Local Government's directive, or if you like, sort of response to the president's directive. And we'll be talking to the mayor of the A.M.A. of the Accra area to find out exactly what the plan is. This is still the Pulse with me, Gifty and Dopia. We'll take a very quick break. We'll be back with more. Do stay. Let me just let you know that we've been joined via Skype by the mayor of Accra, Mr. Jay Soa. He's actually on the telephone. Mr. Jay Soa, thank you so much for your time this afternoon. I trust that you're well.
Thank you for having me.
We've seen your statement that lines up the things that you want to do as far as carrying out the president's directives are concerned. Can you give us a mental picture in a few words what the plan really is?
Thank you very much once again. Following the presidential directive, we were also directed to activate all public health emergency response management committees at the assembly to support our health service to handle or to deal with this particular pandemic situation where we all find ourselves in. So we get also guidance from our Metro Health Director on what we are supposed to do.
Right.
And based on that, we've taken some few steps since yesterday to be able to deal with the issue within the Central Business District and communities along in Accra Central. One of it is that our main office also serves as a location where people also come to register marriages and organize their gatherings. And we're saying that as much as we are not preventing people to marry, we are restricting the marriage ceremony to only the couples and their witnesses to come and sign, or else you then have to postpone your marriage. Secondly, our facility and its environment also serves as a location for lots of outdoor, indoor activities. We've also put on hold all these social gatherings as directed by the president that we should suspend workshops, big meetings, symposiums, and this is in compliance also to that. But to take it also into the communities, especially our markets as well. We have lots of public toilets in Accra, both in the market and in the low-income communities. We've directed all of them through letters, and our environmental health officers are following up for them to have the hand-washing buckets filled with water and soap so that those who patronize the public toilet, either they are entering or exiting, should wash their hands with running water. We've also directed that same applies to food vendors, especially those who are in places where of confinement, the buildings, the restaurants, also to also have say at their point of doing business. And this is also in compliance of our food safety and hygiene bylaws as well. So we intend to step up the enforcement. As much as we are making an appeal, we also want to let the general public know that it's part of our bylaws, and that we need to make sure that we handle ourselves in that manner. But for the past 2 weeks, we've been doing public education through our PA systems. We have deployed 6 vehicles in Accra, Mokola, Okanshi, Bukum Square, Choko, Kolegono, Bubuashi, Kaleshi, all these areas. And we are doing day, night, and dawn broadcasts for mass education. We are intensifying the mass education based on additional information that we get from the health directorate, so that the information will get to as many people as possible before we step it down to look at targeted population. Because we realize that there's a lot of misinformation out there. People are also miscommunicating to others, and we need to straighten up things so that people are armed with the right information. So the mass education has been intensified morning, afternoon, evening, and at dawn in the communities to make sure that we reach out to as many people as possible. In fact,
Mr. Jaisawa, I want us to stay a little bit on the market. It's one of the biggest problems that I personally see. I'm playing a video right now, and I'm hoping that you can see that video, or perhaps you've seen it already, of a very crowded small space of women, men, who seem to be buying sanitizers, hand sanitizers. Now, the marketplace is one of the places where we find so many people, but of course, it's not a public gathering per se. So what is the plan for the market areas? Do they even understand the spacing, the social, the spacing within which they are safe from other people? And how are we going to decongest the markets in these times?
Also say that since the president announcement on Sunday evening, there's some significant reduction in people that come into the city center. People have decided to stay at home, but there's some bricks market also going on as well. And to specifically comment on your concern, we first of all believe that information is key, and the right information is very important. So provide the people with the right information. I mean, just yesterday, we were informed by the health directorate that there's a mad rush for people even to wear gloves. And their argument is that when you wear hand gloves, it makes you act more irresponsibly because you are in your hand gloves and you think that you are immune. So you touch things anyhow, and then you can also affect a lot more people instead. So these are the kinds of information that we think that people should know. And then we can take it up from there. So as much as we're providing the tools and the leadership, we think that information is very key. And let that information get to as many people as possible. There are many people in the market, they don't listen to radio because they are doing bricks business. They don't watch TV. They come to Accra early in the morning and close at night. So we can only reach out to them at their point of business. And that's what we are continuing to do.
Great. Before I let you go again, I want us to talk about the food vendors and the, if you like, transport stations. We saw a video that is purported to be coming from somewhere near either Rwanda or one of those African countries where they set up this makeshift water stands in the transport stations. So before you even get on the bus, you wash your hands. And yesterday we spoke to some of the people at these stations, and they were complaining about their inability to buy soap and water, their inability to, they say at Circle, they say there's no tap here, we have to buy water. Someone says we can't buy sanitizers. Is there a plan for the A.M.A, for example, to provide some of these things at vantage points in the marketplaces and in the transport stations to help if individuals are not taking it upon themselves to do it?
First of all, I mean, we must understand that we are not in normal times, that you will expect government to spoon feed you at every point in time. And I think that that communication should also get to people. If we don't do that, we will have people folding up their arms, things that they can do, they will not do, and then put all of us at risk. So that it is very important. We are doing our part. As I speak to you now, we are continuing procuring the Veronica buckets to be placed at vantage points. If you do so and we are not careful, the same people will also come back and say, come and put in water. When you put in water, the same people will come and say that, come and refill it and, to do some of these things. I think that our communication should inspire people, should encourage people to volunteer, to do more. And this is what I want to urge the people of Accra, that we are not in normal times.
Right.
We think
I think that
people... people, government should do everything for them.
And I get you there, but the point is that if they are supposed to, but if they are not, the thing is that we are all at risk. So wouldn't you say perhaps if they see government take the first or initial step, and then the encouragement comes for them to take personal responsibility, that will be a certain catalyst that moves them towards the right direction, if you get what I mean?
Well, it can come from either way, because I don't think that in your station that you are waiting for government to come and provide you with a hand washing machine or a sanitizer.
We are not, because we understand. We are not, because we understand. But the people at the stations perhaps don't understand it yet.
So my point is that our communication should be for people also to understand, to appreciate that we are not in normal times. We are indeed. I have indicated to you that we are providing the Veronica bucket at certain locations, but it will be practically impossible for us to provide water, the Veronica bucket at all locations within the shortest possible time. The virus is not waiting for us to, before we provide all these things, before it continues. That is why I posed a rhetorical question to you, that in your office, you did not wait for government before you responded to that. And I think that the communication should be out there to encourage people to act more responsibly, to act more fast if you are in the position to do so. And don't wait for government, because we cannot wait for government to do everything for us at the moment.
Mr. J, so I'm really grateful that you joined us, but do you have any final words as we call it a wrap? And when exactly is the enforcement starting?
We just finished a meeting on the second day of meeting with the Public Health Emergency Response Unit. We are grateful that the Regional Police Command were present, and they are also going to control crowds, especially those who want to do social gathering to block. They've been activated. Their points to make sure that they deal responsibly and seriously with people who flat some of these things by putting the rest of the general public in danger. We will not countenance on some of these things.
We'll be on the ground with you to monitor how it's going and also encourage people to be responsible for their own health. But sir, thank you so much for your time this afternoon. Mohammed Nia is the mayor of Accra, talking about the plan, the grand plan, as far as implementing the president's directive. In the meantime, like I said, in Parliament, they're racing against time to pass the legislation that backs it. But